Good morning, my name is Martin L Neugwou. I'm a student practical nurse. In this video, I'm going to show how to administer fleet enema. So about 3 days ago, we administered to our patient the Dulcolax, which is a laxative, and there is still no bowel movement. So today the doctor has ordered to administer the fleet enema. That's what we're gonna do. So for this purpose, I'm using bed rotation number 4, and I have the doctor's order and the PRN MA here with me. So the doctor's order reads, fleet enema PR one time if suppository ineffective. So I'm gonna start with the patient name. The patient name is Carly Patrick, date of birth May 26, 1977, patient ID 4321. So the MA reads Carly Patrick, date of birth May 26, 1977, patient ID 4321, and the doctor's order reads fleet enema PR one time if suppository is ineffective. So 3 days ago, when we administered the suppository the suppository was ineffective. Um, and the MA fleet enema PR every 3 days if suppository ineffective. So I see that the information that I have on my doctor's order, it's correctly transcribed to my MA. So I'll put doctor's order aside, and I'll just use my MA now. I'm gonna go see my patient. So hand hygiene, I provide client privacy, and enough. Good morning. My name is Martin L Neugwou. I'm a student practical nurse, and I'm gonna take care of you today. How are you today? May I have your name and your date of birth, please? The patient states her name or his name, Corley Patrick, May 26, 1977, and I make sure I check that with what I have on the wrist, on my MA and the wristband. Corley Patrick, May 26, 1977. Thank you. So the reason I came here is because 3 days ago you had the Dulcolax and you still don't have any, did not have any bowel movement. So the doctor ordered fleet enema. But before talking about fleet enema, I just wanted to go quickly through your assessment. So your blood pressure, it's at 135/85. It's much better than it was before. So it's leaning towards normal, but it's in an acceptable range, 135/85. Your temperature, you had a high body temperature at 38.5, but now you're sitting at 37.5 Celsius, which is within the normal range of 36 and between 36 and 38. And now we are going to administer you the fleet enema because there is still no bowel movement. So what we are going to do is, the fleet enema is basically a laxative, and we are going to administer that on your through the rectum. So through the rectum. Do you have any allergy? No non-allergy. So the common side effect of the fleet enema is rectal discomfort, but they might, in case you have a really serious side effect, like sign of rashes, hives, itching, blistering, peeling skin, or wheezing, or shortness of breath, tightness in the chest, for example, chest pain, pressure, very bad headache, so, or bleeding, or rectal bleeding from the rectum. So let me know, and we will talk to the doctor right away. I also wanted to let you know that you have the right to refuse the medication. So in case for some reason, I will just have to document that. Do you have any question for me, please? No question. So I'm gonna go ahead now and prepare the medication, and I'll be right back. Thank you. So I'm going back to the desk to prepare the medication. I'm pulling the drawer here and getting the medication. So I'm gonna go ahead and do my 3 checks, 5 rights. So the patient name is Coley Patrick, date of birth 26 May 1977. Coley Patrick, May 26, 1977. The right medication is fleet enema medication, right medication, fleet enema. The right dose, it's 1 bottle, and in the bottle there is 133 milliliters. So 1 bottle, and it's only every 3 days, and the medication said we cannot use that more than once in 24 hours. So the right route is PR per rectum. The right route PR per rectum. The right time is anytime. It's as needed, and it could be anytime during the day, but the doctor has ordered every 3 days, so the right time and frequency. So this complete my first check. So I'm going to now go ahead and remove the medication from the bottle and hold this in my palm and perform the second check. So the second check, the right patient, Coley Patrick, May 26, 1977. Coley Patrick, May 26, 1977. The right medication, fleet enema. The right route is rectal, so PR per rectum. Rectal, PR per rectum. The the right dose is 133 milliliters, 1 bottle, so 133 milliliters. And the right time and frequency, it's every 3 days if suppository is ineffective, so it's every 3 days as needed. Every 3 days as needed. This complete my second check. So my third check, I'm putting that inside my tray, my medication tray. So the right patient, Coley Patrick, May 26, 1977. Coley Patrick, May 26, 1977. The right medication is fleet enema. The right route is PR per rectum, rectal, PR per rectum. The right dose is 133 milliliters, and the right time and frequency is every 3 days if suppository is ineffective, so it's every 3 days as needed. Every 3 days as needed. This complete my third check. Now I'm gonna go ahead now and visit my patient. So I'm back here. Come. I'm back again. I will settle my medication on bedside. So it's me. I'm back again to administer your medication. So I will check again your wristband with the 2 identifier and my MA here. So Coley Patrick, May 26, 1977. Coley Patrick, May 26, 1977. So I have the right thing. So now what I'm gonna do is I'm gonna don gloves. So hand sanitizer, don gloves. I'm gonna go ahead and assess my patient. So I'm asking you, please, if you could lay on your left hand side and adopt what is called the seam position. So your hip and your knee will be slightly bent towards your chest. So for the sake of time, I've done that already with my patient. So I'm just gonna expose the administration area, which is the anus. So I'm gonna go ahead now and palpate. I'm gonna palpate the rectal wall and note any deformation, any presence of hemorrhoid, for example, any fissure, any redness, for example. I'm gonna go ahead and palpate that. So I can see that my patient told me 3 days ago, and I remember that she never had any rectal surgery. So I can see that the skin is intact, and the rectum has a normal formation. So I'm gonna go ahead now and administer my medication. But before that, I'm doffing my gloves, and I'm providing hand hygiene again, and I'm wearing this time new gloves. So So I'm wearing new gloves this time just for the sake of economy. I did not use gloves twice. So I'm wearing new gloves here now, and I will take my medication. So I have the medication, remove the cap. So I'm removing the cap of the medication, and I'm going to lubricate it. But some of the medication, usually the fleet enema comes with, it's a little bit, it's easy to kind of administer that. So I have that. So what I'm going to do now, I'm going to slowly insert that about 5 centimeters inside the rectum, and I'm going to slowly administer that to my patient. So once I'm finished, I will ask my patient to stay at that position for about 5 minutes. So to stay at that position for about 5 minutes until the fluid, until the abdominal cramping is felt. So if you feel your abdominal cramping, that's a sign that there is a bowel movement. So I'm discarding my gloves now. Hand hygiene, and I'm covering my patient now. I'm covering my patient, putting my patient comfortable, raising the handrail, the call light, and I'll stick around for a few minutes to see if there is no allergic reaction. And in the meantime, while sticking around, I'm gonna feel my mouth. So the date today is March 15, 2021. The time is 8 o'clock in the morning, my initial. So, and I can see that my patient is requesting to go to the washroom. That means the fleet enema it's working. So this concludes the fleet enema administration video. Thank you.